Hi, my name is Felicia Roach, and today we're talking about healthcare manager consultants. So, after reading the chapter, we were asked to kind of go through the list of common characteristics, that are represented by healthcare managers, and then we needed to pick two that we already possess and two that we need to improve on. So, the two that I chose are integrity and fidelity. That I already possess. So integrity is something that I kind of lump together with honesty. To me, integrity or having integrity is being honest. It is coming forward when you've done something, that has a negative outcome, or, not taking credit for something that you didn't do that has a positive outcome. It's just being upfront and honest with those you work with and those you work for, administration, your physicians, your nurses, whomever. And then the other one is fidelity. And so one of the definitions by the ACHE, it says abiding by good faith duty, maintaining professional confidences, disclosing financial and other conflicts of interest. So this is super important because in healthcare, you definitely have a responsibility to uphold confidentiality with patients. And you don't want to break that trust with your patients. It's making sure that everything is private. It's making sure that, if you get a really cool case, you're not sharing that with everybody. You're not giving out names. You're not giving out information. And then it's also being upfront and honest about yourself. This says disclosing financial information. I mean, I don't know that really necessarily has anything to do with a healthcare manager, but other conflicts of interest, for sure. If you are into some shady stuff, it's better to be upfront about that firsthand. You don't want something coming out later and that affecting your work. So the two that I said I could work on for sure is competence and commitment to learning. So I'm going to start with commitment to learning. So I work for Mercy, and for both job scribing and being a medical assistant, really just about any other job or career path that you take within Mercy, everybody's required to do this continuing education. So continuing education is online typically, and they make you go through these PowerPoints and lectures, and then you have to take a quiz after, to show that you understand what was presented to you. And it's basically things on, patient safety, all kinds of things like that. Hand washing, we had one on. There are several. And I think I can definitely improve on this by actually paying attention to the lectures instead of trying to click through them real fast. It's not guessing on the quizzes. It's taking it more seriously, even though they're very monotonous and tedious. And then the other one is competence. So competence is having the knowledge and the skills to do your job and to do it well. So I think that I am competent in my job. I think I'm very capable of doing my job, and I'm able to do it and do it well. But there is so many things changing within the healthcare system that I think competence is something that everybody can improve on. It's constantly maintaining that knowledge. It's getting that new information. Maybe it's through continuing education. I don't know. But it's having that knowledge and using it to your benefit within your job. So the next one is, I also want you to discuss any experience you have with individuals like this in your current work or professional setting. So I have, in one of my jobs, I have a healthcare manager. I think she does a great job, in being upfront and honest. I would agree that she could also, improve on her competence and commitment to learning as everybody else can, and really having an understanding of what my day-to-day job looks like and what our physician's day-to-day job looks like, and how not always what administration says works for one individual clinic. So that's, again, finding that balance and finding, what works and having those knowledge and skills. So in my other job, though, I don't necessarily have a healthcare manager, but I do follow a physician around every shift in the ER. And so it's super important that they have these qualities. I mean, again, they're not healthcare managers, but they are big in healthcare. They are caring for somebody, sometimes in life or death situations. So it's really important, that they're honest, that they're competent, that they are just, they do have dignity, all that good stuff. So this says to finally talk about the challenges that individuals in these roles might face. So again, going back to the emergency room, we are faced with difficult patients, or even in the clinic too. Really in all healthcare settings, we can be faced with difficult patients, whether they be complex patients with, several diseases or several, they've had bad outcomes, and they're coming to you seeking care, seeking help. And others may be just jaded, maybe they had a bad experience in another clinic or another emergency room, or what if they had a botched surgery, or something to that effect, and they're coming and they're having symptoms, or they have questions. I think for sure being competent is something that we can really work on and improve. I think that, again, being honest and being just, I think everybody does their best, but sometimes it's hard to tell a patient that you don't know what's going on. You don't know why they're having these symptoms, or you don't know how to answer their question. And sometimes that can be tough to deal with. Sometimes patients don't like taking no for an answer, and I don't know for an answer. So that can definitely be a challenge within my workplace settings, for sure. For example, just the other day we had a patient who was going through a bit of a difficult situation and needing supplies, and she had reached out to our office, and we were doing everything they could, but they still couldn't understand why they weren't getting their supplies that they needed. And it wasn't a matter of me not being competent or not being honest. I did everything that I could. We were still waiting. She was waiting on somebody to contact her, and they never did. So, it's things like that can definitely be challenging, but also make us stronger in the workplace. And I'm hoping that this will also make me stronger with the career path that I'm choosing. I'm going into nursing school. I want to go back into emergency medicine and work as a nurse. So I know that there will be questions that I can't answer, things that I don't necessarily know how to do, but I definitely want to work on improving those things. So that is all I have. So thank you.